Welcome back, UPSC aspirants, to another highly focused explainer right here on the Rungta IAS Academy channel. Today, we're decoding the recently released WHO Global Health Statistics Report. Now, if you're serious about mastering the General Studies Paper 2 health syllabus, you are in exactly the right place. We're going to break down this vital data so you can directly apply it to your mains answers.
Absolutely, sir. A thorough understanding of this report is simply non-negotiable for anyone targeting a top rank this year. So let's get right into it.
Mum, 22.1 million. Now, what does this massive figure actually mean for our students' understanding of global health vulnerabilities? Well, sir, it represents an absolute shock to the global system. This isn't just a random statistic, you see. It's the very cornerstone of any critique an aspirant is going to write regarding healthcare infrastructure. It literally redefines how we must view our global preparedness. Our agenda today perfectly mirrors a high-scoring mains answer framework. We'll cover the true pandemic toll, analyze global health progress, look at persistent vulnerabilities and challenges, and finally discuss the GS2 and interview application.
Starting with Section 1, the true pandemic toll and exposing global vulnerabilities. Aspirants, get your pens ready because this is exactly how you craft a powerful introduction.
The WHO clearly states that between 2020 and 2023, there were an estimated 22.1 million excess deaths. Now, the absolutely crucial takeaway for you here is that this number includes indirect deaths. It is more than 3 times the number of officially reported COVID-19 deaths. This brilliantly illustrates the severe gaps in our global health systems, basically showing us that our tracking and reporting mechanisms were completely overwhelmed.
Exactly. And that leads us directly to a phrase you absolutely must memorize. The report categorically states that the pandemic reversed a decade of gains in life expectancy. Make a note of that immediately. When you're writing about the uneven and incomplete global recovery across different regions, dropping this exact quote will prove to the examiner that you've thoroughly studied the primary WHO sources. Moving to Section 2, Analyzing Global Health Progress. This provides excellent data for your body paragraphs. Because remember, a balanced UPSC answer must always acknowledge the progress we've made. And this WASH data is pure gold for your GS2 answers on social justice. Just look at the massive scale of expansion and access to basic services. Between 2015 and 2024, 961 million people gained access to safe drinking water, 1.2 billion to sanitation, 1.6 billion to basic hygiene, and 1.4 billion to clean cooking solutions. This water, sanitation, and hygiene data is directly linked to improved health outcomes and poverty alleviation. You need to use these exact figures to show the tangible impact of state and global interventions.
Looking at regional data, we're seeing incredible success in the WHO African region. New HIV infections dropped by an impressive 70%, and tuberculosis is down by 28%. However, on a global scale, malaria incidents actually increased by 8.5% since 2015, which pushes us quite far away from our targets. But wait, here is the critical point for our Indian students to note. The report specifically highlights that the Southeast Asia region is well on track to meet its 2025 milestone for malaria reduction. Always remember to highlight India's regional context.
Now, Section 3, Persistent Vulnerabilities and Challenges, with a specific focus on women's health. Let's examine where the systemic gaps still lie. This next statistic is deeply concerning and highly relevant for your exams. Anemia currently affects 30.7% of women of reproductive age globally. And crucially, there has been absolutely no improvement recorded over the past decade. Aspirants, you must use this stagnant data to critically evaluate the effectiveness of our ongoing nutritional and maternal health policies. It's a crystal clear indicator of exactly where systemic interventions are falling short. Furthermore, the WHO report points out a very grim reality. Intimate partner violence currently affects 1 in 4 women globally. Now, you have to understand, this is not just a social issue, it's a massive public health failure. This data breach connects perfectly with your GS1 society paper and your GS2 syllabus on vulnerable sections. Widespread violence directly shapes health outcomes, and you really must analyze it from both of those angles. Finally, Section 4. GS2 and interview application, the way forward. Let's discuss exactly how you should synthesize this data when you're finally sitting right in front of that UPSC interview panel. Imagine the board asks you this exact question. Well, now you've got the ammunition. You start with the 22.1 million excess deaths to show the systemic shock. Then you expertly balance it by mentioning the remarkable WASH progress and the Southeast Asia malaria milestone. Finally, you critically point out the stagnant anemia rates and gender violence to highlight the immediate policy needs. Aspirants, utilize today's analysis to frame that winning answer. Keep studying, stay incredibly focused, and we'll see you in the next explainer here at Rungta IAS Academy.